Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today? I have the very, very talented Dr. Yash. He is a board-certified plastic surgeon based out of Dallas. He is part of, is it Dallas Plastic Surgery Center?
Yeah, Dallas Plastic Surgery Institute.
Dallas Plastic Surgery Institute. So, you know, he is a great surgeon and he's with great company at his practice.
Okay.
And what we're going to be talking about today is rhinoplasty. Dr. Yash, I know. You know what? A lot of surgeons tell me that their favorite procedure to do is rhinoplasty.
I'm not surprised. There's something alluring about rhinoplasties. It's really like, honestly, it's probably one of the toughest operations we do in plastic surgery. And I think that's probably why everyone's up for the challenge. Everybody wants to like tackle that challenge. And that's probably why it's one of the most common answers you get when you ask, what's your favorite procedure to do? Even if you're like great at Mavi makeovers, there's something about the nose where people want to be able to do great rhinoplasty.
Yeah. And you know what? There's something about the nose that like you have to be really, really skilled and gifted at rhinoplasty.
Oh yeah, it's very unforgiving. It's very challenging. Every nose is different. Everyone's anatomy is different. There's so many variabilities between ethnicities. If you've had prior trauma before, if you're an athlete, you had your nose hit before. There's so many variables that come into play when you do a rhinoplasty. And, at the end of the day, people want similar goals for their nose, give or take. But to get there, everyone's journey in the operating room is different. And it's really your challenge as a surgeon to be able to do that for them.
Can you tell us, okay, so let's say we love talking about the same procedure over and over again with different surgeons because we always get little jewels. Like everybody has their own seasoning. Everybody has their own spice. And I love hearing all the different techniques and why you do this and why you do that. So I would love for you to take us through like a patient journey of, are they even ready for a rhinoplasty?
That's the biggest thing is selecting the right patients for the surgery. With rhinoplasty, it's very important, just like any plastic surgery procedure that we do. When I see a patient for a consultation, especially for a rhinoplasty, I really want to spend time with them before we can get into talking about their nose. I want to get to know them. I want to know a little bit about their personal life, what bothers them about their nose, how it's affected them a little bit. And kind of once I really get an understanding for that, I really go into understanding what bothers them about their nose. And I always try to find out exactly what are the patient's top three concerns. What I'm trying to answer is, can they clearly describe to me what bothers them about their nose, or is it kind of just generic terms like it's too big or it doesn't fit my face, or I want to look like this celebrity or that celebrity? And I really try to redirect them to understand, can they clearly describe to me what aspects of their nose they don't like? And if they can't, then it's my job to really educate them and help them see their nose the way I would see their nose so they can describe to me. For my opinion, rhinoplasty, for like a consultation with the patient, it's like, I really want to be able to speak their language. They want to speak my language. So I really understand exactly what they want so I can deliver that for them. We spend a lot of time in consultation going over that together before I even touch their nose, look inside their nose, and really get all my answers during that exam phase. So it's a rhinoplasty consult.
When you're doing a rhinoplasty consult, do you do digital imaging?
I do. I think it's super important because, like I said, patients may say one thing to me like, oh, I think my nose is too long, or I think I have, a bump on my nose or it's crooked. And, even though it makes sense to most people, what I see or what I understand might be slightly different. And then using digital imaging to morph and kind of recreate, I'm doing this myself actually. So we'll get standardized photographs during every nose consult. And these are standardized views, frontal, angle, lateral, and basal views on all angles. And I use those imaging to recreate what I think the patient really wants. And I send that to the patient typically at the end of the consult. And they give me feedback. They say, that's exactly what I wanted. You really understood what I wanted. Or sometimes they say, I kind of expected something a little different. Wanted my nose a little more natural, not so deep projected, or I wanted a little bit more upturned. Can we do that? And then comes the real conversation. Is that a realistic goal for the patient? Because you can do anything with digital imaging. And I think that's where it's really important that the surgeon does the digital imaging for the patient. If you have somebody else in your office doing it that doesn't do the surgery, sure, you can probably make it look like that with digital imaging. But the real question is, can I do that in the operating room? And if I can't do that, I'm going to tell the patient, I understand what you're looking at, but that's probably not realistic for you to expect. And sometimes they really appreciate that. They go back and say, I'm glad you said that to me. And I think that's the real consultation process. It's not just, can you do my nose? Yeah, I can do your nose, and let's schedule a date for it. There's a lot of, gray area that you have to kind of understand with the patient before you get to the point of, let's go to the operating room and let's nose that you're looking.
Would you clarify this for me? Because I used to get this question and I get it all the time that, I have a deviated septum and that's why my nose is crooked. So it should be covered by insurance.
Okay, I get that all the time too. I think I'll tell you this. Everyone has a slightly deviated septum. I look inside people's noses all the time, and everyone's got a slight deviation. Some are a lot more significant than the others. And there's different types of deviations as well. C-shaped, S-shaped, reverse C, all sorts of things. When it comes down to, does that deviated septum really affect your breathing? That's when insurance sort of kicks in a little bit. And you can go through insurance. Now, from an insurance perspective, there's really two codes. There's a septoplasty that's going to correct a deviated septum, and there's a rhinoplasty code. And in most cases, the rhinoplasty code doesn't always get covered. And the way I see noses is there's always a cosmetic and there's a functional aspect to it. But in my hands, it's never mutually exclusive. I think every nose is a little functional and a little cosmetic. And so when I do rhinoplasty, I tell patients, I'm going to make sure that I make you breathe better, or at least you maintain how well you breathe. But I'm also going to help improve the way you look as well and kind of address the cosmetic aspects of your nose. I think when patients try to say, let's do it under insurance so I can get this partially covered, but then I also want all these other cosmetic things done as well, it gets a little tricky, it gets a little dicey when you're managing the finances with insurance companies. And I'll tell you this, I've done rhinoplasties under insurance before. And when you ask the patient at the end of the day how much they ended up spending, it's almost about the same that they would have spent if they just went through the cosmetic approach. So, for me, I don't really do insurance rhinoplasties because I want to be able to deliver that full experience and simplify the process for the patient. It's already a complex operation, and I don't want them stressing about the nuances and the details with insurance, no insurance, and finances before surgery.
Yeah, like picking and choosing, like, okay, well, I'm only going to do this because the insurance covered it. If I do this, it's not going to be covered. You're limiting yourself.
You really are.
That also goes to other surgeries that are cosmetic, like breast reductions. So I know from experience with breast reductions, usually you have to follow whatever the insurance requirement is for the minimum amount of grams that can be removed in order for it to be covered by insurance. So for example, if you're going into the office and you have like big D's and you're like, I want to go down to a small C, that's not going to be covered by insurance.
You're right. There are certain requirements to go under insurance. And, the way I see it is, breast reduction under insurance, you have to take out a large amount of breast tissue. And sometimes that leaves the patients with a very unesthetic result. And that's kind of the downside of going through insurance, in my opinion. When I actually just saw a breast reduction consult this morning, and, I do things, I kind of tailor the operation for the patient. Let's do liposuction to your lateral chest. Let's use an internal bra to help support the breast tissue so you prevent bottoming out. Let's do something different to make sure your incisions heal as nicely as possible. Let's give you a nice aesthetic shape and volume. Sometimes you don't have to take out a lot of volume in a breast reduction to give a great result. These are things that you're just a little limited if you go under insurance. I'm not hating on the insurance approach. I'm just saying, at the end of the day, we want to do surgery once. We don't want to do it twice. And I think sometimes spending a little bit more upfront to get that result is totally worth it. And, some patients totally hear this and they get it and they go with it and they love it. And some patients, I get it. Finances is a big deal and that drives their decisions, but that's a risk that they're willing to take. And I think it's my job to kind of let them know the pros and cons and the different approaches. It's not the same operation in my hands, insurance breast reduction versus a cosmetic breast reduction. You're just able to do so much more for the patient cosmetically. That's why I like doing it that way.
Yeah. And let me tell you guys, when you're going through your insurance, you have your deductible, you have your co-insurance, you have your out-of-pocket max. All of these funds have to be like your deductible has to be met before your insurance kicks in. So for example, if you have a $12,000 deductible, you have to pay 12 grand before you can your insurance benefits even kick in. And sometimes the 12 grand covers the surgery. So that you're kind of shooting yourself in the foot because you're paying the 12 grand, limiting yourselves to how the insurance requires you to do the surgery. So you don't really have all the freedom of like adding lipo, doing other things while you're in there. And you still have to pay that full deductible plus, depending on whatever facility you're using, their co-insurance and any facility fees, all of that comes at the end. You'll get a bill once you're healed from surgery. You're going to be like opening the mail. Oh my God, what is this?
Right.
Who wants that?
And it's totally out of our control at that point. You're kind of dealing with the insurance companies. And the nice thing about going through the plastic surgeon and doing cosmetic pay is it's a lot more controlled. When you go through insurance, you could get letters in the future and you're dealing with them directly. You also mentioned something else, Mavi, about facility. Sometimes we like to do procedures in our own facility. We have our own team. We have our own anesthesiologist. It's like our home turf, and we operate the best there. When you go under insurance, you got to go through a facility that does insurance. And so even though it's the same operation at the end of the day, it's a little different because you're operating in a different environment. You have a different surgical tech. These are little things that at the end of the day, I think do matter. I like operating when I'm comfortable, when I'm happy, when I know the people in the room. They know my likes and dislikes. They know my preferences. The surgery goes smoother and I can just focus on the patient and the surgery itself versus dealing with everything else, in the operating room.
Yeah, you made a really good point, which also leads us to our next point, which is medical tourism for rhinoplasties.
Yeah.
What are you seeing?
That's
Tell me.
I have an opinion about that. And I'll start off saying this. I think, the two biggest locations for medical tourism for rhinoplasty, I think, is South America, Mexico, and Turkey. And I think if you go on social media, you'll see it. They're everywhere. They market well. And I'll say this as well. Some of the Turkish rhinoplasties are great. Turkish rhinoplasty surgeons are awesome. They do great work and they offer it at a very low price. I think that's what really attracts patients. But I'll ask this question to our listeners. When has it ever been that cheaper is better? When is it always been that, something that costs less is going to be better? There's not a lot of things that actually cost less and that are also better. But for some reason, when it comes to rhinoplasty in your face, people are willing to take that risk and do that. We talk a lot about the consultation process for rhinoplasty. It's a very personal experience. You really want to get to know your patients and really understand what they want and give them that customized result. I believe, in my opinion, that not all noses should be the same. I don't ever want patients to come and say, I want a Dr. Yash nose. I want them to say, I want this nose, and can you give that to me? A lot of times people are saying, I want a Turkish rhinoplasty because there is a aesthetic to the Turkish nose. It's a very sloped, hyper-reduced, over-rotated, and very well-defined. And sometimes that's a home run for some patients. It looks great on them. And realistically, sometimes it doesn't look good on other patients. Especially in rhinoplasty, you start talking about prior differences, ethnic differences in the anatomy and the results. Turkish rhinoplasty may not look good on you. And when you go to Turkey or when you go overseas to get your rhinoplasty done, you're going to miss out on that personalized experience. And you're sort of taking a risk there. Sometimes it works out and sometimes it really doesn't work out. And I think that's the real deal with medical tourism and rhinoplasty.
I think you're right. I didn't notice it in rhinoplasties. I noticed it in BBLs. Like the BBLs they do in Turkey, like they have a certain look that they all kind of look the same.
Yes.
on all these different women. Like you can almost tell it's a BBL that was done in Turkey, kind of like you can tell the BBLs that are done in Miami.
Yeah.
They have
There's a look.
there's a look.
There's a look, and I think that's fine if that's ultimately what you want. But I'll tell you this: I recently had to redo two patients. They had their rhinoplasty done in Turkey. They're Asian, and they said, "This is not me. This doesn't look like me." They like aspects of the rhinoplasty, but I had to redo certain aspects of their nose to give them their older nose back, so it doesn't look so different. And they're super happy. And these are just little things that, at the end of the day, you really can't get that customized experience when you start traveling overseas. The other thing, I'll tell you realistically is, and this is true for anybody in America, any plastic surgeon here in America, and true for myself or any of my colleagues in Dallas, there's accountability that we have when we operate on a patient. We're board certified plastic surgeons, or at least you should be at the end of the day. And there's an accountability that, when you do surgery, you want to make sure your patient's happy. And if they're not happy, you want to make sure you do what you can to get them there. At the end of the day, it's not whether you like what you see, it's what the patient sees. That's what's most important. When you start traveling overseas, you might think you know your plastic surgeon, but when you come back and you're not happy about it, they rarely call their plastic surgeon overseas, because at the end of the day, the surgeon may not even remember who that patient is. And they're kind of stuck over here dealing with the problem. And then that's when they start going around to plastic surgeons in the US, seeing if they can get the problem fixed. Medical tourism, those surgeons, overseas, they don't have that accountability that we have when we're seeing a patient in our own country. I think that's a big difference. And you really can't force somebody to have that accountability. When you're doing high volume rhinoplasty, you're doing aggressive marketing, you're doing noses every day, numerous noses, giving the same results. That's great. And I think more power to you, but I think you miss out on the accountability a little bit. And when it's something like the rhinoplasty, it's your face, that stuff matters. It's your personality, it's your life, it's your social life. I just think it's just too much to risk. And I think it's important to have a connection with your plastic surgeon, get the surgery done in a place where you can follow that plastic surgeon, or plastic surgeon can follow you along for the first year, and make sure you're doing well and you're healing properly,
You brought up a really good point, which happens to not just rhinoplasty, but when you're doing medical tourism, most of the time there's a language barrier. So you're working through translators, whether it be in Mexico, whether it be in Turkey, wherever you are, there's a language barrier. And I think that also prevents that communication between the surgeon and the patient, because you can't really explain what you mean. And also with medical tourism, as much and as exciting and as much money as you're saving, you are losing out on a really important part of the surgery, which is building a relationship with your surgeon and being able to communicate exactly what you're looking for in whatever surgery it is. If it's face, rhino, body, BBL, breast, you can't really explain what you're looking for. And a lot of these medical tourism places, from what I've heard from people who have gone through it, you're booking with the consultant. You don't ever meet the surgeon until you're there. You come in and meet the surgeon 2 days before surgery. They send you for labs. And then the next time you see them is the day of surgery. And then you don't see them again. You follow up with.
It's apples and oranges. I think it's a completely different model. And I think we see more of it now. We see a little bit of that in the US with larger, franchise type, plastic surgery centers you deal with a consultant, high volume, you get in for the consultation, never meet your surgeon. I really think that's very anti-plastic surgery. It's very anti-cosmetic surgery. I think, like you said, this is a big deal. I think there's a journey, there's an experience, there's a relationship that you should build with your plastic surgeon. And when you don't do that, you're really missing out on a large part of the whole journey, the whole process. And you're totally right. I think when you never see your plastic surgeon before the day of surgery, especially with the nose, you're missing out. You're taking a big risk, missing out on a lot that you should have done before you get on that operating table.
Before you even take that flight, you're flying across the world. Let me tell y'all, I've had horror stories of patients telling me they planned for this, they've booked, take time off work, do this, do that. They fly to wherever they're having surgery at. In this case, it was actually Miami. But they fly there. They had never met the surgeon before, but then they meet the surgeon once they're already there, ready for surgery. And the surgeon's like, hey, I can't do your surgery. You're booked for a lipo, but you actually need a tummy tuck. And how did this get missed? This should have been like
exactly.
How did we get here? Surgeries canceled, lost recovery home, lost flight, lost time off of work, lost all her money because they would not refund her money. They said, actually, you need to pay, I think it was like $12,000 more to go ahead and just do the tummy tuck, but you don't get your lipo money back. You don't get anything back. So either you pay the next amount and you book the next available surgery date, which is like in 8 months, do the tummy tuck then, or just lose your money by call yourself a taxi.
I mean, how terrible is that? It's like once you take that flight up there, you're sort of handcuffed. You're like forced to do whatever happens at the end of the day. Like, are you going to fly back without plastic surgery? It's kind of like, it's almost not fair to patients realistically, you know. And well, what if you get there and you don't like your surgeon? You know, what if something doesn't connect and you're like, no, I don't like him. Are you just not going to do surgery now all of a sudden? Are you going to just forego all that expense you had? I mean, that's actually one of my requirements. It's like, does the patient have good expectations? Do they understand what the journey is going to be like? And at the end of the day, do they like me and do I like them? Because I think that this is a relationship. It's a big deal. You know, we get to see the patients back, you know, throughout the first year and make sure they're doing well. And there's so many plastic surgeons out there. If there's no connection, it's, you know, I'll tell patients, I encourage them, get a second opinion. Because, you know, before you decide to do plastic surgery or rhinoplasty with me, you got to be happy as well. You just can't have all that when you travel to Turkey or overseas, you know, you're just kind of forced to accept what you're given.
Yeah, because I've had patients that, I mean, we talk about this stuff and they're like, I went ahead and did whatever, like, because it's not just one conversation that I've had with somebody that has had this happen to them. It's been multiple times. And this one in specific that I'm remembering, they told her she actually needed a tummy tuck. And she was like, well, I'm here for lipo 360 BBL. And they're like, well, that's not the procedure that you need. And she's like, well, that's what I paid for. Well, that's what she ended up getting. But it was just like she was forced into doing the procedure because she had already done all of the legwork. Like she was already there. It's kind of like either I do it or I lose all my money and all of my energy and effort.
It's that. And there's a lot of horror stories. There's a lot of like destroyed, you know, emotions. And, you know, patients, I've seen patients come to my office saying like, they said they were going to do a thigh lift, small scar, and it's like my whole leg and I have an infection, destroyed the way I look and my livelihood. And it's like, you feel bad for them. You want to help them. But at the end of the day, and this is really important, it's not like you can just come back and say, if I don't like it, I'll just get a plastic surgeon to fix it. It's not that easy. Anytime you do a revision surgery, whether it be a body case, a breast case, a face or nose case, anytime you do a revision, things are just different. It's not the same as getting it right the first time. And it's not like you can just undo it and fix it, make it look exactly the same as it should have been the first time around. When you deal with revision cases, tissues are just different. And sometimes you're kind of stuck with what you have, or at least a version of what you have now. You know?
Yeah. I think we couldn't have left off on a better note. We know rhinoplasty is a very personalized, individualized procedure. You have to have a really good relationship with your surgeon and you want them to understand what you're requesting, what you're looking for, what bothers you, right?
Exactly.
Clear communication, understanding the recovery. We didn't go over that. Recovery, typical recovery for rhinoplasty.
Typically, they're going to have stitches or splints, you know, at least for 1 week. They come back, they get those removed. And then, you know, I tell patients bruising and swelling are real parts of recovery. I use a few different things in surgery to help reduce the bruising and swelling. So they're virtually not bruised by 1 week, but swelling is real. And swelling is on the course of months, not so much days and weeks. Everyone's a little different. Everyone's ethnicity is different. Some patients don't swell that much. Some of them do. But it's really a 6 to 9 to 12 month process of watching that swelling sort of get better with time. And sometimes as a surgeon, I got to intervene and do a few special things to help that swelling settle down. But I tell patients, you'll see the results at 1 week. You're going to like it, and it's going to get better with time. It's kind of like fine wine. And then by the 1 year mark, that's when you really get to see what that nose is going to be like, you know, moving forward.
So the rule for rhinoplasty is patience. Patience.
It really is patience. Really is patience. Trust the process. Be patient. do your homework. But yeah, for sure. It's totally patience.
So, okay, you can't repeat what you said, but give us, our listeners, if it was your sister, your mom, somebody who's thinking about having surgery, what is one tip that you would give them for their plastic surgery rhinoplasty journey?
One tip would be is to see as many consultations as possible. And I know that's as a plastic surgeon, like, why would you tell someone to go see multiple surgeons? I think that's super important because it's like when you're looking for a new house, typically you'll look around, but when you know which house you like, you go for it. And it's kind of like finding your rhinoplasty surgeon. You'll start looking around, you'll talk to different surgeons, maybe have 3 or 4 consultations. But when you know you found the right plastic surgeon to do your rhinoplasty, you'll know. And I think it's a little short-sighted to just pick the first plastic surgeon that you go see. I think it's a process. There's a real process to finding the right rhinoplasty surgeon. And I think that's really important because at the end of the day, it's one nose, it's one face, and it's a really important procedure. You want to make the right decision. I think you'll see just from seeing different plastic surgeons, everyone's got a different approach, a different aesthetic, a different vibe. Staff is different. Everything's got to click for you to really go forward with that practice or that plastic surgeon. So I think that's really important. That would be the one thing I'd say is see, 2, 3, see a couple of plastic surgeons, get a couple of consultations before you decide.
That is a really, really good piece of advice. I 100% agree because it's like you're looking for a partner. You have to connect with their staff. You have to connect with the surgeon. You have to connect with the price. You have to connect with the recovery. Yeah. There's so many different aspects to the whole journey that you have to take into consideration, and definitely going with the first one that you meet.
Exactly. And, you may end up going with your first surgeon that you saw after you saw 2 or 3, but at least now you know for sure that is the right person to go with. For sure. Versus just saying, I went with him and then, I never really went to the other consults. And then you just, again, it's like you should give yourself that chance to look around a little bit.
For sure.
Or any plastic surgery, to be honest with you. And when you know,
the more you know, and honestly, you're so right. Even if you pick that first surgeon that you went to, because probably you've been researching, they were at the top of your list and you went to see them first. But once you've gone to see others, then you're like 100%, okay, this is the guy.
And I get a lot of patients that say, I love everything that I see, but I have 1 or 2 more consultations and then I'm going to decide. And I say, that's great. Go for it. We hope to hear back from you. And sometimes they do come back, and that's great. I'm super happy about that. But I think that's the patient's right to go around, talk to other surgeons, and really do their own homework. And that's really important.
Yeah, 100%. Yeah. Thank you so much for coming on, Dr. Yash. You're so pleasant. Every time, y'all are going to get to hear some super fun games that we got to play at the Beautiful Mind event here in Houston a few weeks ago. So you get to hear Dr. Yash and I play a little trivia. Here it goes. You guys, we're coming live to you from the Make It Pop event, and I have the very wonderful Dr. Yash from Dallas, a board-certified plastic surgeon, and he's going to be playing our 3-minute trivia game.
Uh-oh. Okay.
Exciting. You only get 2 passes.
Okay.
And it's lightning round. So answer the questions as fast as you can. And if you can't think of an answer, you can pass or we can go back.
All right. Sounds good. Let's go.
All right. So the first question is, if you were a surgical procedure, what surgical procedure would you be?
I would be a rhinoplasty or nose job.
Why?
Because it's so delicate. It's detail oriented. Everyone's different. Every nose is different. And that's kind of like what I'm like. I feel like I'm super detail oriented.
I like it. I love most plastic surgeons. Their favorite procedure is always rhinoplasty.
It's just something about it. I don't know what it is.
Okay. So let's go to the next question. Would you rather run a marathon or go skydiving?
Skydiving.
What?
Yeah, for sure. Not to say that I actually have skydived as well. But I would probably do skydiving because it's short and it's exhilarating versus a marathon is probably something that's long and tests your endurance.
I see. You know what I always tell my plastic surgeons? Just don't do anything where you can hurt your hands because I need those for surgery.
Yeah, you're totally right. This one would just knock me out completely if it didn't go well, though.
Yeah. Okay. Next question. Would you rather vacation at a ski resort or a beach resort?
I'm a sucker for the beach. I love beaches. So totally beach resort.
Beach resort. All right. I think I would pick beach too.
Yeah, for sure.
What is your most requested celebrity nose?
Ooh, celebrity nose. I actually get a lot of Kim Kardashian as one of them. That's probably the most that I get right now.
Kim?
I haven't gotten a lot of celebrity noses, to be honest with you. But if they do, they're kind of showing me her nose.
I've never looked at Kim's nose to say, oh yeah, her nose is beautiful. It doesn't draw attention.
I think there are other things that they're noticing with her, but sometimes her nose does tend to kind of be nice as well.
Well, then that goes to the next question, which is, who do you think is the prettiest Kardashian?
I like Kim. I really do.
Kim.
I definitely like Kim.
Okay. Ooh, this is one that we have a reoccurring theme on the show that I always ask my plastic surgeons.
Okay.
Are you team drains or no drains?
I am team drains.
Yes.
I've always been a team drain guy. I love drains. I think they help. They reduce swelling. They take the fluid out, especially when you do a lot of hard work to get that definition. I think drains have a good purpose. There's a reason why we've been using it for so many years in plastic surgery.
I agree. I'm team drains too.
Yeah, for sure. We can cut the number of drains, but you always want to use drains.
I agree. Okay. Let's go to the next question. So it's all about lasers these days. If there was one laser treatment that you would pick, what laser treatment would it be?
Ooh, that's a good one. I would pick erbium as a laser treatment. The erbium YAG is the Cyton jewel. I like that one because you can dial it up, you can dial it down, you can do fractionated. You can do a lot of good with that, and you can use it in a lot of places. I typically use it for the face. I combine it with my blephs as well. So if you want a little bit of skin tightening with your eyelid lifts, I use it sometimes for the upper lip to give a little bit more of a lip lift as well. Super powerful. And you can use it on men, women. It's great.
I agree. I love that procedure. Okay, so this is a good question. What's your favorite surgical tool?
I like, this is kind of random because a lot of surgeons don't always use this, but I like the number 11 blade. And it's like, we have typically we'll use 3 different types of blades, a 10 blade, a 15 blade, and then a number 11 blade. The 10 blade is the big one. Use that on the body or the breast. The 15 is a little bit smaller, so use it on the face. And the 11 actually is it's sharp and pointed. And so if you really want to do precise work and carving and cutting, I use that one.
I love that. I love getting these answers.
Yeah. I bet you got a different answer each time you ask that question.
Yeah. I love hearing the different procedures that y'all pick, the different tools that you like.
Yeah.
It lets us know a little bit about you, a little bit about...
Yeah, I think so. And everyone uses them differently too. What I would use, I'm sure if another plastic surgeon heard that I use 11 blades, you're going to be like, what's he using 11 blade for? But when you see me use it, it totally makes sense. So
what do you use it for?
When I'm actually cutting certain types of cartilages in the nose, I love using 11 blade. Or when I'm dissecting a plane, sometimes I'll actually use that because it's very precise.
Nice. Yeah. I like that. Okay. So what is the longest surgery that you've ever done? And tell us everything about it.
Okay. Longest surgery was probably something like 17, 19 hours. This was back when I was in training at Duke. And it was an abdominal wall transplant, actually.
Wow.
So we ended up taking another person's abdominal wall with the muscle and the skin and all of that and transplanting to another patient. This patient had a lot of had a complex medical surgical history, and they had just lost so much surface area of their abdomen that the only real option was to take someone else's abdomen and transplant it to give them coverage basically of their abdomen. So that operation was a full team, but it was multiple hours, multiple services, plastic surgery, there was transplant surgery, everybody was involved. It was at least 17 to 20 hours long.
Wow. So did you have to be in the surgery for the whole...
So I was actually one of the lucky guys where I was able to actually be a part of the whole operation with the other surgical team from my service at Duke. And it was cool because we got to be a part of the whole operation. You take tissue from one body to another one, and you got to sew the vessels and put it all together. So it's kind of it's the ultimate, the ultimate abdominal wall surgery.
Wow. Yeah. That, I haven't actually heard of that.
Yeah. You hear about face transplants, you hear about hand transplants, right? Because there's a lot of damage to the hands. People, fireworks and stuff like that in face, but ab wall, In fact, there have been more ab wall transplants than there have been like face transplants. You just don't hear about it sometimes.
Wow.
Yeah.
I had no idea.
Yeah.
You learn something new every day.
For sure.
Especially when you talk to plastic surgeons.
Yeah. You don't realize like that's what we do also sometimes. So
part of why I love plastic surgery is because it's not just cosmetic. When I started in plastic surgery, it was in breast reconstruction.
Oh, wow.
So watching women go through that journey was something that really stuck with me, and watching them go from having their breasts to having mastectomies to then coming back for reconstruction and getting their female confidence back with either implants or a deep flap or whatever it was that they were choosing. It really impacted me and how I see women's confidence and how I see how something that can seem so vain is really not.
I totally agree. It's really like the foundation of plastic surgery. And recon, I mean, I use a lot of those principles even when I do like complex revision cases in aesthetics, like revision breast cases. Like you almost put on your recon hat and like, let me approach this from a reconstructive perspective, because that's exactly what the patient needs, you know? So, but I totally agree. I love all of it. I mean, I obviously chose aesthetics. I love the detail. I love the final shape and the final result. And I think that's kind of what draws me to it.
That's wonderful. I love to hear that. Okay, let's see. What is our next question? What is the craziest procedure that a patient has asked you for?
I get guys who are in great shape sometimes looking for calf implants. And that's not really crazy, but I think it's crazy when you look at them and they're in such good shape and you're like, you really don't need calf implants.
I've had patients who have unrealistic expectations of how they should look.
That's true. I get that a lot. And I think that's what makes our job so hard, is you got to kind of take that and kind of show them what's realistic and what's not realistic sometimes.
Yeah, I love that. You guys, we didn't even tell you where we are right now. We're live at the Make It Pop event. If you didn't make it to the Make It Pop virtual event or to the in-person event, let us tell you a little bit about what Make It Pop and what we're doing with the recovery systems. So what we've learned in the last 2 days with the Make It Pop virtual event was how to plan your surgery, the 5 mistakes that most women make when they're planning their surgery.
Right.
And honestly, how important nutrition and mental health are. So important.
So important.
I would love to hear how, in your opinion, mental health affects a surgical journey.
I mean, I think it's part of the roots of a surgical journey. I mean, we do this every day. So we're thinking about the surgery. We're thinking about the procedure. We get excited about that. But there's a whole journey that the patient goes through, from deciding that they want to have a consultation to going to their last follow-up. And that's a roller coaster emotionally and mentally for them. And if we don't take a second to think about that and appreciate that and kind of help the patient out through that process, you're going to have some problems. You're going to have unhappy patients. You're going to miss something that you didn't see coming when you're talking to your patient or understanding their expectations or dealing with something that may happen after surgery. So I think it does require some attention. And that's what I love about Make It Pop. They're actually bringing it to light and giving it a place in the whole journey to kind of work on and improve and help the patient out at the end of the day. Patients that have a great experience, I think it's not just the result, but it's also their headspace and their mental happiness as well. And I think if you don't take that into consideration, you may have some unhappy patients.
Even with the wonderful result,
exactly.
Even with an A+ result.
And that happens. And that's when, as a plastic surgeon, you're like, I don't understand. We did exactly what you're looking for, but the patient's not fully happy. And I think that's when you realize you probably need to spend more time in pre-op talking to the patient, understanding where they're coming from, why they're doing the surgery, why they want the surgery, so you can actually cater the operation and manage their expectations better for a happy, successful journey for them,
Absolutely.
Yeah.
Definitely. And would you say that during a consultation, there's signs that you can pick up?
Yeah, we always talk about quote unquote red flags. It's not really red flags, but it's like you got to read between the lines. And I think it's really important to develop a relationship with the patient first to understand where they're coming from. I think then you'll be able to really better read between the lines. And I think there are certain things you want to look out for. If patients can clearly describe what they want, either on their body or in a picture, then maybe they need to spend more time thinking about it to understand exactly what bothers them. And maybe in some cases, some patients, it's not really anything on their body that bothers them. It's something else that's causing them this disharmony. So bottom line is, if patients can't really describe what they want or what bothers them, then they probably need to spend more time. Because I think in those scenarios, you're walking into an area where you're walking in the dark. And how can you help somebody if they can't explain exactly what they want?
That's very true. You make a very good point.
Yeah.
So if you're listening, you have to have exactly what you are envisioning. You have to be able to communicate that to your surgeon.
Right. Gotta have a clear understanding of what you want. And whether anything, breast surgery, tummy tuck, body surgery, it's more about you. And I spend a lot of time having the patients talk so I can really get an idea of where they're coming from, what they want realistically. I think that's more important that's the first phase. The second phase is then talking about the surgeon and the surgery, which is just as much as important. But that's when the patient really has to start asking us the questions,
Mm-hmm. I tell my girls, when you're consulting, it's not just you interviewing your surgeon to see if you're going to book with them. Your surgeon is also interviewing you
so right.
to know if they're going to take you on as a patient.
I mean, you're so right. Because it's a match at the end of the day. Like, patients have to like the surgeon, surgeons have to like the patient. It's a relationship. It's not like a one and done scenario where you have surgery and you're done and you magically look a certain way. It's a full journey. You actually even have to like the office staff as well, because you'll deal with the surgeon, you'll deal with their staff just as much. And, everyone's got to be on the same page. Otherwise, it's not as much of an enjoyable experience. And, we have so many plastic surgeons now in the world, in the country. There's a reason why every surgeon's busy, because there's always a patient that caters to them or that connects with them. And that's the nice thing about plastic surgery.
You guys know I love plastic surgery, so I don't have to elaborate on that. Okay, so one last question. Do you think Martha Stewart had a facelift?
She looks good. I mean, you're talking about that Sports Illustrated cover page? That was awesome. I don't think she has. I think she's aged really nicely.
No, you're wrong.
She had one?
She had one.
Get out of here.
She had one recently. And I think it's hilarious because I saw her comments and she said it's drinking water and horseback riding.
Oh, gosh. Because horseback riding is really the anti-aging secret.
It's really great for your face to be galloping on a horse, right? That's really going to bring the face back up instead of bringing it down.
I totally hear that. Okay, I'm going to look more into this then.
She says it's just water and horseback riding, exercising 3 times a week. But if you look at her pictures, which the pictures don't lie, you have pictures of you before, and then there's pictures of her after. And she looked worse at 65 than she does now at 80.
You don't think she went on Ozempic or anything like that? Like lost
Wouldn't
some
that
weight?
make your face worse?
I mean, it would have you droop, but I mean, it's Martha Stewart we're talking about. You never know, right? I'm going to have to take a close look. You know what I'm going to do now? I'm going to go look at her pictures and see if I can see the incisions.
I think, you can't see the incisions. Only in one photo that she posted where you can see her lip lift incision slightly.
Oh,
but
that's a giveaway.
You can tell she had a bleph. You can tell her lower face she had a neck. She did the whole shebang.
She did the whole thing.
She looks so good.
She does.
If she would just admit it.
That's the thing that gets me sometimes. I feel like, why don't people just be honest about it? Especially when they're celebrities, it would actually, make plastic surgery less taboo, because it's like so-and-so who's so prominent, everybody knows, goes out there and shares their experience and how, look, she looks great. She's got tons of buzz on that. Everyone's talking about that right now. Why not give the credit where it's really due? I'm sure there's a surgeon out there that's like, wait a second, I did that.
Have you seen those memes of the surgeons that are like, the celebrity influencer talking about her slim fit tees, and the surgeon's like, wait, I did that.
Yeah, I know. It would actually help so much, actually. I feel like it would just make it easier for everybody to be comfortable with coming in for plastic surgery.
Because would you say that most of your patients are regular moms?
Yes, they're not celebrities. Okay. And they're moms. And sometimes the first battle for them is to be comfortable with actually going to see a plastic surgeon. I mean, I have patients who are in my consult room and they're like scared. They're nervous. And I'm like, why are you nervous? It's just me. Like, I'm not scary. And let's just start off with telling me about yourself, and I'll tell you about myself, and talk plastic surgery, because that's the first barrier. You got to just break down that nervousness or that fear of, oh my God, I'm going to see a plastic surgeon. Once you break that down, then you can start talking about everything else, and it comes easier after that. But I think when we put up these walls, like we do, like on social media, nobody wants to tag their surgeon. That's fine. I'm not hurt. But at the end of the day, like if you're open about it, it just makes it easier.
It makes it easier for the other women who are feeling like, why can she do it and I can't? Why does she look like that? And naturally, is it her genes? What is she doing that I am not doing?
Well, then you start thinking you really got the short end of it and you got the worst genes. But I think we all pretty much have pretty average genes. It's just some of us get the procedures done, but we don't talk about it,
That's true. So I know that here in Houston, somebody every day you're walking past someone that had something done around the city.
Yeah. I mean, I was in Miami for like 7 to 10 years and I felt the same way about Miami as well. Dallas is kind of like that, but in Dallas, people just show it off. Like you go to the mall, someone's got a splint on their nose still. So it's like, it's a little different, but yeah, I think between Houston, Dallas, Miami, people are more open about it at least, or they want people to know about it.
They want people to know about it, but also I feel like because of pop culture and it's starting to become a little bit more with the younger people, they don't care as much. It's the older generations that are still hiding it, that are like, no, Martha Stewart, I didn't do anything.
Yeah, exactly.
But the younger girls that are like, hey, I had lip filler. I had one girl on TikTok. I saw her yesterday. She tagged a comment and the comment said something like, I wish I looked like you. And she replied and she's like, I spent $30,000 to look like this. Like these brows are laminated.
Good for her.
Yeah. She's like, my cheeks have filler. I've had a boob job. I've had a BBL. Like, do not think that you're less than me.
That's awesome.
Just had the finances to go through with surgery. And she's like, and you can do it too. But I thought that was so empowering because it's the truth when you're online and people think that you naturally look like that.
Sure.
It creates this unrealistic expectation.
Yeah.
And also makes younger girls or girls who look up to you feel bad about themselves.
I totally agree. It's no different than the social media world where people are using filters or Facetune or whatever it may be to kind of make themselves look a certain way. It's the same concept, right? You're putting out something that may not be exactly what it truly is, right?
Mm-hmm.
But I think we're making progress. I feel like there are more and more people out there like the person you talked about on TikTok that are real about it. They're keeping it real and they're sharing their experience and they're saying it's not that bad. And it's actually, look how happy they are. Look how good they look, right?
And they're happy about it. It's like, hey, you can do it too. You can look like me too.
Exactly.
It just takes a little bit of money.
Exactly. And planning. Yeah.
Okay. So last question. Between a breast augmentation and a BBL, which one is your favorite?
I would say a breast augmentation. I feel like this is more of a, are you a TNA person? But I would say I'm more of a breast augmentation person. I like the operation a little bit more than the BBL in that sense, but I think they're both great operations.
As far as breast augmentation, are you an implant or a fat grafting?
I do both. I love silicone, saline, and fat grafting. I think there's a different patient for each one. If you're looking for, I mean, I tell this to every patient, but like with fat grafting, it's not really an exact science yet. So if you put in 300 cc's, you may not really get 300 cc's afterwards. When I put in a 300 cc implant, you're going to get 300 cc's out of that. So it's a little bit more exact in that sense. You have a little more control over shape in some ways as well. I like also doing composite breast augmentations where I'll use an implant, but I'll also do fat grafting as well. And that helps with camouflaging some asymmetries, improving the shape. It's actually, I feel like we've gotten to a point where we can really give the results that patients want because we have all these different techniques and tools to kind of work with realistically.
Yeah, I love that you said that because I like to tell my girls, my audience, when you're going to see a plastic surgeon, and why I recommend seeing 3 consultations is because you're talking to that surgeon and he's going to talk to you about whatever tools he has in his toolbox.
Right. Exactly.
And like with lasers and all of these things, skin tightening treatments, it's not that some surgeons don't offer it because they don't want to, or it's not in their toolbox.
Sure.
But maybe somebody else does. Another surgeon does have that in their toolbox.
Right. And maybe both of them give you the same result, but just with different tools. It's really, that's the nice thing about plastic surgery. It's not like every operation has the same steps and everyone's just going to do it and you're going to get the same result each time. And that's where, you really have to talk to your surgeon, look at their results, get an idea of what their approach is, and then make the decision for yourself. But there's a lot of variety in plastic surgery. There's a lot of creativity. And I think that's what makes this field so cool. That's why I love it. So I love doing it. Yeah.
So lastly, to end our lightning round, tell us, why did you become a plastic surgeon? What made you choose that path?
I always knew I wanted to do surgery. That was just some passion of mine that I've always had. I knew I wanted to use my hands. I wanted to be a surgeon. I just really didn't know what kind of surgeon. And I was in Miami at the time. I went to University of Miami and I had an opportunity to go down to Haiti to help out after the 2010 earthquake. And there's tons of victims there. And I went down there with a team of plastic surgeons, believe it or not. And we did all sorts of cool surgeries to help the patients and the victims. And we did other things as well. And then I was like, this is so cool. Like the detail, you work from head to toe, you work on the face, you work on the body, you work on the legs. It was great. And I came back and I just started exploring more and more. And I knew that was the field for myself. And then I trained for 6 years over at Duke. And then we got exposed to all areas in plastic surgery. And I made the decision for myself that I love the attention to aesthetics and detail with everything else that I know. So I wanted to do more in aesthetic surgery.
And then when you started going into aesthetics, you naturally leaned into rhinoplasty.
Yeah, I think that was always a natural draw for me. I just like that operation for everything that it's, known for, the detail. Every nose is different. They're very challenging cases. Everyone says it's one of the toughest surgeries in plastic surgery, but I love that kind of a challenge. And I really like learning from every case that I do and making it better, one patient at a time. And then I apply that detail to kind of everything else that I do as well, whether it be a breast surgery or a body surgery or a liposuction surgery. The thing I like about liposuction now is it's not just about removing fat. Now we're talking about high definition liposuction. And there's some pioneers in the field that have made it so realistic for all of us to perform. And I almost think of it it's like a rhinoplasty detail to the body. You're really analyzing the body, you're trying to give that high definition result. And that kind of attention to detail, it kind of reminds me of when I'm doing a rhinoplasty.
I love it. I love that. Thank you so much, Dr. Yash, for being on.
Yeah, thank you for having me.
If our listeners want to come see you, where can they find you?
So they can find me in Dallas, Texas, or they can find me on Instagram at Dr. Yash, DRYASH. I'm on YouTube and I'm on TikTok as well.
I love it. Thank you so much for being here.
For sure. Thank you for having me.
So you guys, if you want to go see Dr. Yash, you can visit his Instagram. You can also send me a DM and I'll send you over there, because now that he's been on the show, if you tell him you came from me, you'll get the extra nice treatment.
There you go.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for Bruise Juice, you guys don't sleep on Bruise Juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code.
And don't forget, new episodes every Monday. I'll see you then.